Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
Welcome back, and we're moving now into our first segment for the morning. Of course, this is our COVID-19 update. I'll courtesy Fulltech Systems. Thank you so very much. Reflecting when Belize detected its first case of COVID-19. It was a big scare for the fact that we actually saw everything that was going on internationally. But there were a few people who were actually in the forefront as well, and we've got some of them in with us, two of them in with us actually. Dr. Marvin Manzanero, who is the former Director of Health Services, around that time he was, and Katherine Meighan, who is Belize Chamber of Commerce and Industry, who's representing the Belize Chamber of Commerce and Industry. Guys, good morning and welcome.
Hi, good morning.
Good morning.
You know, when I saw this morning, I was like, okay, what would I like to know? But Dr. Marvin, Dr. Manzanero, I'd like to start with you. I'd like to start with you for the fact that you were in the forefront. You were the one who actually broke the news. You were the one who actually made us feel calm. Let's get back to that particular day. March 23rd, 2020. What was that day like for you?
You know, that's that entire weekend, because it was a Monday when the news was broken around mid-morning. But perhaps to do a little bit of history of what happened on that weekend. On that sample of that first index case for Belize, or officially identified in this case, was actually on the Friday. So that sample made its way to the Central Medical Lab on Friday evening, and the processing started Saturday, went into Saturday evening, and we do a confirmatory test. So that actual result was on the Saturday night going on to Sunday morning. I believe I got the call maybe about 1:30 in the morning on Sunday, and then I couldn't sleep. That's going on to Sunday. I was reminded just a couple of days ago that there was actually a family reunion on that Sunday that I went, and I don't recall that. I remember everything else, but I don't recall that. Where I was just reminded that I wasn't really participating. I was physically there, but I kept getting calls, I guess, in preparation for, giving out the news on that Monday morning. I mean, the relevant persons above me had been informed, and the decision had been taken to break the news on the Monday rather than on the Sunday. But that doesn't mean that work stopped, because we then started the mapping on that Sunday of that particular case, with surveillance and all the other elements we needed to take into account. And I believe that week we would go on to identify two other cases from that same index case.
Yeah. It's a different lens that you can look back in 2020 with what we know today. But at that time, there was so little known or understood about COVID-19. The only thing that we did have, Dr. Manza, was the benefit of a delayed start. Do you want to put that into perspective for us? I know the World Health Organization had already declared COVID-19, then the novel coronavirus, it was already COVID-19 as a pandemic a few weeks earlier. How did that help us in our response?
Well, it does. And that same, I think, 2-month delay still becomes applicable right now. So we can't lose sight of what's happening in Europe right now. So yeah, you basically have a 6 to 8 week delay. Yeah, and recall that the response started even from early January, when we started rolling out our influenza plan. We had the master plan, and then we just had to create a separate plan for what was coming. The training had started. An internal COVID-19 team had been created. We sent our staff for training to Mexico City in terms of the lab.
Yeah.
That's important. I think that was almost a month before we got the first case. We started the procurement of lab supplies back then, even though they were limited. I think the first batch we had was only 100 samples that we could have done in country. Mm-hmm. And again, that's things that we need to look at and understand, that we were, in a sense, somehow better prepared than when we had faced SARS in 2003, even H1N1 and the bird flu variants that eventually came. Recall when we had H1N1, like a decade before, there was no testing that was done here. All the samples had to go to Port of Spain. Then that there's an opportunity there, and the fact that you are able to better understand where it's going to come from. If you recall, also the flights that were being people that were being banned from certain countries. So there was a lot of work that was happening before that first case eventually arrived on our shores.
Yeah.
You will also note that the date had been announced of when the airport was going to be closed.
Yeah.
So the patient that came in, because it was an imported case, came in like the week before the airport actually was closed. So again, we knew that's where it was going to come from. And what you're sharing actually on the screen right there is the first online system that we had. We also had the beauty of being able to create information in real time for persons.
Yeah.
So that was created, to start the mapping of where cases are going to start to come across the country. So it gives you a head start. I think it gives you a head start for all the subsequent waves that have happened, and for the next wave that is surely going to come.
What are some of the significant markers for you for the pandemic over the past 2 years? Clearly the first case detection was big for all of us, and I always remember kind of seeing your facial reaction as you were the one who delivered the news. And so where the country was scared and concerned, you were at the forefront. So tell me some of the moments in the past 2 years in managing the pandemic that stick out for you.
Well, that's one. The first case that strikes out. The first death that was reported and how that came about. And it speaks of how private and public system situations are understood. Actually, the first two deaths, as I recall, were basically managed. And again, you go back to the initial deaths reported were basically managed in private sector initially and then came over to the public system. So I think we were in essence prepared in that light. The fact that we were able to go 50 plus days, I believe it's 53 or 56 days, without a single case being reported. The fact that you have to be changing situations. If you recall the state of emergency that was created in San Pedro and the panic situation where things really got a little bit out of hand because people started leaving the island before you could do any real surveillance.
Yeah, that was a scary.
Doc, let me go back. I always had questions about that decision because shouldn't it have been expected that if you say the state of emergency come into effect, 2 days later, that everybody was going to try to leave?
Yeah, but you see, there's lots of things with human reaction. I noticed that before the segment got started, you were talking about humans and the social interaction. You can't predict how we are going to react.
Yeah.
Right? And then even after the state of emergency was declared, you will recall that there were boats leaving in the dark with no lights, leaving San Pedro. But you see, what that leads to is what led to decision making eventually. And I know Ms. Kathy was part of the National Oversight Committee, and I'm really thankful, again, because I was perhaps the front of what was happening, but decisions that were made were sometimes done in tandem with business sector, churches, and everybody else by the oversight. But we didn't anticipate that was going to happen then. So that we had so many people on the island that were willing to leave, because it's not only people that worked in the island, there's people who lived in the island who want. But this is important because when the other cases started to be detected, we were in the Cayo district. And we found the link to the Belize district. And I know one of the things we said was, okay, we need to perhaps lock down the Cayo district and maybe the Belize district. And based on the reaction we had in San Pedro is what led to this national lockdown. Because we said, there's no way you're going to be able to control people in a certain district in Cayo and Belize. Mass people are going to start traversing the roads. And that's why you had a lockdown initially that started April 1st, if you recall, and ended the 30th of June.
Yeah.
So it starts to again, remember the second wave really started in San Pedro towards the end of July, and how you start monitoring your response.
Yeah.
And
So I think the
let
emergency
me
was
get Kathy
Yeah.
into the conversation
Yes.
here, because I mean, when you consider some of the moves that were made, and hindsight is 2020. I want to start off by saying that. But when you consider some of the measures that were made, the business impact is one that we still are dealing with today. There was the committee. The chamber was a representative on that committee. Kathy, tune us into what that was like as a representative of the business community, facing things like curfews and lockdowns and no movements and no
yeah.
inter-district travel.
Right. So it was intense.
Yeah.
Perhaps that's the best word
Yeah.
to describe it. In the sense that, COVID is and continues to be the unknown to some extent, right?
Yeah.
We've learned so much, as Dr. Mansa referenced, for us to be able to, the prediction components are there a lot more now. But it was rather intense to figure out how to apply what we've seen in other countries to Belize, right? And there was most definitely, we knew, tremendous economic effects. There was the social angle of it. How do we blend? There were the lives that were at risk. Just listening to the conversation about San Pedro, that was one of the toughest decisions.
Wow.
Because we fully understood the impact that was very huge, and we had lots of very substantive conversations and debates at the table about how it would affect all these various sectors. And from the business end, most definitely that was a huge concern. But the question was, and it was a constant process of trying to think bigger picture. The question was, if we, at that initial stage, if we don't do this, what does that mean for the rest of Belize? What does that mean for, the wider economy? There was so many questions, and it was never a question of, this is the right answer. It was a question of what was the answer given the circumstances and given the information that we had at play that would minimize and enable us to manage the risk. Yeah. And that comes right back to business, because that's what we have to do. We're no different from any other environment or relationship, if you want to call it that, right?
Indeed.
We're trying to manage risk, and out the gate it was pretty tremendous. I was doing some reflection and going back through some statistics and numbers to try to identify. And when we compare the statistics from the BCCI, we did do some internal surveying for our members, and also those from Beltrade. Beltrade had kicked in and was working to try to identify from the various resources and connections and communication networks they had. And we're looking at about 14, something in the mid-teens in terms of closure. Right. And that was primarily the tourism industry. And now we know, how we knew, but now we know in numbers how significant the tourism industry was to our economy,
Indeed.
With 40% of GDP, for instance. Right. And we saw high 80s, we saw 85, 87% of businesses saying we are going to be impacted. Yeah. And we are expecting losses. And we saw, at some of the big numbers we saw coming into to March, April, we saw about 23% unemployment or loss in jobs, so to say. We also saw, because I wherever possible, we got to think about the solution and the silver lining or the lesson learned. And we also saw a lot of businesses say, we do not want to downsize. In looking and reviewing on all of this, one of the things that the businesses were asking for was, we need help to identify ways to retain our employees, right? The question about access to financing was a big question as well. I remember conversations about what was happening in Italy, and as I'm sure you remember, Italy was very much impacted, and what the Italian banks were doing at that time to offer resources available and funding and extensions, so to say, for businesses to be able to survive this, right? Because we also had no idea how long it would take.
I think
sorry, John.
One of the things that stood out to me was at the lockdown, at the lockdown point. And I always wanted to get from, of course, the chamber, what was that like, knowing that, okay, a lockdown is coming, business will be tight, there won't be a lot of people moving out there. What was the utterance from the business community, Kathy?
The utterance from the business community, it was mixed. There were many that were, no, we can't lock down, but there were others as well, and we can't really describe the percentages of, and I think in terms of the way forward, what I recall most importantly was a mentality and a thought process, specifically from the chamber and from the conversations we had internally, that we need to identify a way to survive this, right? So it was a conversation about the now, but it was a conversation about the future going forward. And given the circumstances and what we saw at that time, and what we were hearing as well, because it must be referenced that we did, Dr. Mansa was attending a lot of these WHO sessions and coming to us with feedback and input from those conversations. And and it was that's why intense is the word again, because there was no fully correct answer, right?
There was
and
no
we
precedent.
we tried to say no, things can't be locked down fully. But the question was, if we don't lock down, what do we do? Now we see a different approach, and obviously, that approach is, in my view, a better approach, right? If you want to say it that way, or a more balanced approach. But the question was, that was the best approach that we could have possibly tried to balance between all of these components as well at that time, and the knowledge we had and what was happening and the experiences. And coming back, I remember a lot of questions about how do we get out of this as quickly as possible and as safely as possible? Where was the test? What was the opportunities, and what could we do with tests to control this? How could private sector be more involved in supporting those efforts to enable us to be able to evaluate where the risks were and control the situation as best as possible as well?
So let me ask Dr. Manza a question here, because I think one of the things that doesn't get stated enough is that the Belize response was based on the Belizean reality, and that is where our healthcare system was and what it could accommodate. And while there are always efforts made in improving healthcare, that still is a reality for us today.
Yeah, but and going back to also what Kathy just mentioned, in terms of what was being shut down, understand that there's the element of the human factor where even if businesses were not shut down, people basically out of fear shut down situations. So you have some people that were not moving at all. So people were talking about the tourism, but the tourism sector was being shut down anyway because people stopped being a tourist. What you are saying is very important, yes, because we were looking at our situation and we had to internalize what was happening outside and seeing how best we could manage. But even in that, and even today, whatever we were doing, and I was reviewing the data for today's show, Central America was still looking at us because they said, how comes you went down so many days without having a case?
Yeah.
I used to have meetings with CARFA every month, every day, we were on a WhatsApp conversation at 6 in the morning because it was 8 o'clock for them. And they were also looking at Belize because Belize's situation in the Caribbean is a little bit unique because all of these are Caribbean islands isolated.
Yeah.
We were in a midland between two countries and Mexico having raging numbers almost all of the time and not locking down anything.
So we're looking at the graphs now. That's Belize to the bottom, right? To the bottom.
And that's from the IDB. Actually,
Yeah.
we were one of the last. That's when we had gone many days. Those are like the last countries standing, if you will.
That's when we were at 0 cases, I think, for about a few months.
From middle of April to June,
Okay.
first couple of weeks of June. And as I said, people in the Caribbean region would look out to us and say, okay, what are you doing? What is the plan? What's your public health measures so that we can capitalize? Because as Kathy said, we were learning from each other. We couldn't necessarily look at what Italy was doing in terms of their health system, their economy. We had to look at economies that were similar to ours. So even when airports got closed down, Jamaica would look at us and say, okay, how are you going to go about opening this? How do you close down schools? Remember, schools didn't really close down.
Yeah.
People just stopped sending
Stop
their
sending
children
the kids to school, yeah.
Yeah.
that week of that very week when we identified the first case before the first case was announced. The week before, I know my son was going to school and nobody showed up that entire week.
Yeah.
So things were being shut down out of fear, if you will. So yeah, it's the reality of Belize, but it's also being able to learn from that experience because whatever was done wrong or whatever was done right, you need to be able to rectify as you move along because something is going to come up. So you learn from that. I mean, learn from all the plans, modify your plans that are there, and you have to move on.
I think, you're right. Because I've also thought of, the country shut down, I think, or peak at that time was about 18 cases. And we've had days where the number of active cases are over 10,000 since then.
Yes.
But we knew so little about COVID-19 in early 2020.
Yeah.
You said something earlier, Doc, and I want to come back to that because in the very beginning, there was a lot of look back at 1918 and what happened there. And there were many similarities. But that includes that there are, in fact, waves. And there are the times in between where it seems like life will go back to normal and then you saw another spike.
Another spike, yeah.
How many waves do you consider that Belize has actually had? Because shutting down at 18, I don't know if we can really call that the first wave.
Yeah, that.
It's a ripple because that's whatever it was. I mean, you can't deny the fact that people died even if in that first wave.
Yeah.
And those are cases that you managed to identify. You could have had more asymptomatic carriers and people who eventually left the country, so you never know. Then we had that second wave started in July, and I think it peaked until January of last year. And the third wave with the Delta.
Delta, yes.
Delta, and then the fourth with, I think, Omicron.
Yeah.
The first wave, I don't think we'll know that's probably the original variant. The second wave, I know people have said it's the Alpha variant that was creating that, or the Beta variant. If you look at the literature, it doesn't seem that would be, because we started to have our cases right around the election.
Election was a spreader.
Yeah.
I mean, if we...
So the Alpha variant wasn't really in circulation in the region. And that more than likely is that unknown variant that the Mexicans have identified that caused their wave and was never really labeled. I think that's the same variant that eventually infected me. So I think we have had 4 waves, and I mean the first ripple, if you will, but I think it's 4.
Yeah. And, because time is winding down, I don't want to lose the ability to ask Kathy, or to actually say, though, Kathy, that for some people, having to be out of a job actually caused them to create their own business, and that's one of the things that we actually see happening at this particular point. Let's talk about that, Kathy. What have we identified or seen so far with respect to businesses and how business is actually growing at this particular point?
Great question, John. And there's so many learning lessons, and to talk about another word that begins with I think ingenuity is a word, and we saw that from the unemployment. And if you all will recall, at some point the unemployment numbers, including the underemployment component, got as high as 60%.
Yeah.
And there were a lot of micro businesses included in there. They were on the front line, if you want to say it that way, of businesses that got affected. And you saw a lot of new things come out of that. Let's start with some of the basics. Here, we are still using Zoom.
Yeah.
Zoom was not something that we thought was a part of our normal form of doing business.
You're right.
And or even communicating, right? We saw, the BPO is a great example, and I can speak to the BPOs because I'm in that industry, and I remember the incredible ability to come together, right? And there's that human angle of it there, where we came together and we said, guess what? We are all in this together. That's a very used statement, but it is a very true statement. And we came together, we identified ways to enable employees to still work, right? Getting them home. That was a tremendous effort and cost. And most people don't even know what that entailed. That meant, hundreds of thousands of dollars invested in networks and technology from the BPO sector to get people home. We're also talking computers, we're also talking internet arrangements. There is a lot of work put into, and I'm specifically talking from the BPO industry. There was also, these components with agro-processing, with there was so much at play. There was the identification of, a big concern, as you may remember as well, was the peg. What's going to happen, right? The talk of devaluation was a conversation as well, right? And a very
restrictions on foreign exchange. That was
right.
Credit card, everything,
Exactly, right? And what did that mean? So there were these huge components of, and we're so small at the ending of the day of an economy, and we're so interconnected in so many ways. Looking back at the statistics again, how tourism affected directly and shipping affected directly, agriculture, sugar, energy, etc. The developments that had happened, coming back to the BPO component with technology and where we were at that point where it was affordable for not all, but more than prior. That helped tremendously to enable, a number of persons to go home. And as Dr. Mansa, as you all mentioned as well, there was a real fear. There were a lot of people that, that wanted to be in this isolated environment where possible. And it was a reality in the businesses as well. And, our human capital, as we know, is extremely significant. It's our biggest asset, as we all say on the balance sheet, and in terms of both angles, right? And, being able to have persons being able to function within a business environment meant that we had to adapt. Meant that we had to, work in ways that were different. There's a lot of service providers that still have a hybrid arrangement where they have persons coming into office, but quite a number of persons still working from home.
Can I jump in there and ask about that? Because that's something we see very, very much in the United States, the debate over returning to work or returning to the office. Some places are saying, it isn't even necessary to go back into an office. Do we have any inkling of that in Belize?
That's true.
That's a question. I would say the answer is there is some of that, most definitely. And I think it's an individual business decision based on culture and structure of the business itself. There are some businesses that the work from home environment may well offer lots of benefits, right? There is a benefit to working from home in this, and if you are a result-driven culture where it's less about, whether you are there in front of, let's just say, a counter to serve a customer, but more about the reporting and the actions on the ground that you can do, like a like for instance, accounting, like for instance, auditing, right?
Yeah.
For instance, legal services. These are examples where, you know, where you don't need to be speaking to an individual all day, every day to get your job done, right?
Yeah.
Whereas there's other businesses that required that level of communication just by the nature of their business and their operations. So I think, you know, COVID has changed the world. What we have to look at is what are the lessons learned? What makes us more agile?
Yeah.
What makes us more sustainable, right? What enables us to be able to produce and be as efficient as possible? And what's a good balance with, you know, what encourages and what's a safe environment for employees as well, right? Businesses understood that if you were not careful, you would end up closing down nonetheless because COVID would come to your doors.
Yeah.
Right. So there was all these angles that had to be considered too.
Yeah. All right. So, Dr. Amanda, I do want to get in one question here. I saw your presentation that you put together, and your final point is a warning. In fact, it's a really interesting time because COVID is still around, and we know what's happening in the rest of the world. But it kind of feels like we're all getting back to what is our new normal, living with COVID. Tell us a bit about your insight as to what lies ahead. Do you think that this will simply be the way we exist now with an illness that can potentially kill people, but there are preventative measures in place and now treatment?
Yeah, so I had put that slide because somebody who, and I think the name is right there, Rika Youth, had done that for the healthcare workers when we went through that lapse. And I sent also to the producer a separate slide because, yeah, it's not going to go away. And as I said, we need to be able to learn from what's happening in other countries. But I think even to piggyback on what Kathy said, you see that slide there that says Omicron, the original strain in dark blue, and then the red one that's now starting to become prevalent, and the numbers that are there.
That's the stealth Omicron?
Yeah, that's the one. So for a country like ours, if we are not careful, you know, or even for countries who don't have newer technologies, we might, that might not be able to be detected, and you might already have it. So we need to be able to understand that we need to learn from what has happened. And I think there's an important structure here with Kathy just mentioned, you know, in terms of people going to physically go back to the office. If we are still demanding that an 8-to-5 job in this new norm, then I think we haven't learned anything from COVID. I mean, people are moving away from this 8-to-5 structure where you can. And even countries such as Europe, where they're cutting back their work days to 4, working hours to 6 instead of 8. CDC in some departments, CDC working 3 days in the office, 2 from home, because your level of productivity might still be the same. So if we are doing those decisions based on the previous structure, then it shows that we haven't learned anything from COVID. And I think there's 2 words that I want to highlight, even from a personal viewpoint, is we should have become more resilient. And I think resilience and empathy are the 2 words that from the social structure that we are as human beings. And I think it's the same thing that becomes applicable to health systems, businesses, and everybody else. Resilience. If we don't know how to live, and you mentioned the right adjective, the new norm, as we had said 2 years ago, I don't think we are going to go back to whatever was normal. It is a new norm.
Kathy,
this is the new life that we're living. Let me just ask one more question, Dr. Manzanero. What classifies the end of the pandemic? What are the markers that will be used?
Very valid question. That's actually an open discussion at WHO to see when you're going to classify the end of the pandemic and when it becomes something that you can call, okay, it's an endemicity kind of situation. There's not a straight answer, and I think it's going to, because the other issue is when are you going to consider an outbreak, right? Because, I mean, you had an outbreak in the first case, but when you go to the epidemiological definition, it might be outbreaks once you start having new clusters coming up. So I think that definition should be coming up before the end of the month in terms of when it is no longer considered a pandemic, but it's an endemic situation. But I think,
Do you foresee that declaration being made soon?
yeah, I think by the end of the month.
Sweet.
But I mean, the definition of what it will mean then, because I think it might be regions or countries taking their own definition based on that. But again, this should have been a preparation, because when you look at One Health approaches, when you look at global health and how globalized we are, whatever happened in 1918 may not be comparable simply because we live in a globalized village. So if we are moving in terms of One Health communication and all these elements, technology notwithstanding, I think this is, I mean, I don't want to be the bearer of bad news, but we should see it as a rehearsal, because I still think that there's going to be something that is going to be much more, or can be much more lethal, higher mortality. It doesn't even have to be the way it was spread. It could be aerosol, it could be blood, just like Ebola.
Yeah.
There's lots of things that can happen. So I think it's going to eventually happen.
So who's documenting the lessons learned from the planning and execution for this pandemic?
I have, I'm writing books. I have people in the region still reach out to me in terms of what has happened, what's happening now. I still review information on a daily basis.
Yeah.
Colleagues from Central America, colleagues from Mexico, Caribbean, still, we still dialogue almost every day now, because it's not only COVID-19, but the lessons that it leaves for a broader health system.
Yeah.
As it is right now, I am going to a lecture from one of my alma maters that will look at COVID-19 and what it means for research in tuberculosis, because tomorrow is World Tuberculosis Day. So lessons learned for almost forgotten disease, because even tuberculosis patients fell through the cracks over the last 2 years.
Yeah.
Same question to you, Kathy, because this is a lesson. I know continuity planning is critical for businesses. How does the chamber, private sector, kind of drive that message home that you can't just plan for hurricanes anymore? We now have to plan for pandemics.
Right. And indeed. So, that was, and pandemics was something that we, for whatever reason, we just did not factor in that would be, we were going to be where we are right now. So it was rather intense. I think the lessons learned is I like what Dr. Mansa mentioned. It's the movement forward in, taking the lessons, learning them, applying thus with skills and a communicative way of being, but also with empathy as well. And I think some of the key lessons learned is, businesses need to prepare. They need to be. It's the same lessons that we've known for quite some time. It just COVID reminds us how significant it is that we have or continually reflect and identify ways for us within the business community to be able to, be as agile, as strategic as possible as well. There were some key points that, stood out, quite conversations that we had about what was necessary.
Yeah.
And some of the conversations included, tax reform, which is a conversation that we need to continue to have, right? Conversations about, foreign exchange availability, which continues to be a reality, right?
Yeah.
2 years later, we talked about expenses, for business, including fuel, right? Which is a conversation that we've been having again recently. And so these are conversations, and what it all comes down to is ensuring that we within Belize set up and have a business environment that is most conducive to well-managed and agile and sustainable and transparent business and a transparent business environment, or an economy across the board that is better prepared for the next disaster, whatever type of disaster it may be, right?
All right.
This sort of disaster has proven to be much worse than any given hurricane, because there's an end to that hurricane. This one is still not ended.
Still ongoing. Yeah, you're totally right. You're totally right there, Kathy. And I'll tell you what, we There's so much we could discuss with this because I've still got a lot of questions, but we do hope that we could get you guys back again
Yeah.
so we could continue to discuss along the lines of this. We're so thankful you've joined us this morning. Dr. Manza, thank you. Meighan, thank you so very much. And here's to wishing you a very good day.
Thank you.
Very much.
All right.
You all take care and be safe.
All right. We're about to take a break. When we come back, we'll be talking about Women in Stride. Now, this is an event you don't want to miss. Women in Sport. We've got the folks to talk to us all about it when we come back. Stay with us. We'll be right.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.